Good morning, everyone. It's a real pleasure for me to share with you this presentation. As Nelson Mandela said, it always seems impossible until it's done. Today, we are going to talk about how the impossible can become reality in TB innovation. Being here in Windhoek, a city that blends innovation and tradition, is a perfect backdrop for a discussion on transformative TB intervention. So as you can see, the outline of this presentation, it's known that more than 10 million people continue to fall ill with TB every year, and the number has been rising since 2021. And more than 1 million TB deaths have been reported in 2023. The disease burden has already shifted from predominantly infectious disease to predominantly NCDs, with increase in prevalence of NCDs in all the countries or globally. As of 2025, NCD kill 41 million people each year worldwide, an equivalent of 71% of all deaths globally, with over 85% of premature NCD deaths in limited and middle-income countries. So as you can see, when we talk of NCDs, the Africa region is in red. And we need to monitor closely this, because there is an increase of about 142% compared to other regions. Between 2021 and 2025, developing countries are projected to incur losses about 7 trillion due to deaths, 2 trillion to the loss to the NCDs, equivalent to 3.5% to 5.9% of the GDP. This slide is referring to HIV burden. As you can see, in terms of triple 95 as a global goals, we are not yet there. And there are specific disparities in terms of gender and age groups. As you can see, we are not doing well globally in terms of children and male. Though in female, we are doing a little bit good. While Sub-Saharan Africa is doing a little bit good in terms of decreasing the number of new infections in HIV, we can see also that Middle East and North Africa is doing not really good in terms of increasing the number of new infections of HIV. This slide shows the burden of TB in terms of and the catastrophic costs. As you can see, there are countries with the percentage of people with TB, but that are experiencing the catastrophic cost linked to TB. You can see the countries that are really having a high level of people with catastrophic cost. And in terms of trend in estimated TB incidence rate by WHO regions, we need to monitor closely the region of America. As you can see, there is a kind of increase in trend of estimated TB incidence. There is a growing burden of NCDs among people living with HIV. In Africa, for instance, there are 15 million people on antiretroviral therapy who are at increased risk of developing NCDs due to aging. And this is really known to be linked to the chronic inflammation as a result of long-term HIV infection associated with an increased risk of chronic conditions. HIV, TB, and NCDs, comorbidities, increases the complexity of patient illness and care management. This is well known, and this leads to a negative health outcome and increased the cost related to health care and level at all levels in community, individual, clinical, and countries. The HIV patients have nearly twice the risk of developing cardiovascular disease compared with the HIV negative individual. And women, you know that women living with HIV have a six-fold increased risk of developing cervical cancer compared to those who are HIV negative. And people living with HIV are more likely to have type 2 diabetes compared to those who are HIV negative. And HIV positive patients are twice as likely to experience depression also compared to those who are not HIV positive. So I just wanted to share with you this interesting systematic review that analyzed 114 studies and found that most health outcomes were improved with integrated care services. In summary, you can see that integration of HIV services and other health services tend to improve health and health system outcome. The success of integration strategies was highly context-specific, and more evidence and they emphasize that more evidence is needed on integration in a specific geographic area and for key population in the HIV response. We would like to say that integration of HIV, TB, and NCDs is a pathway to saving life and strengthening health system. Integrated HIV and TB treatment services averted an estimated 6.4 million deaths between 2010 and 2022. And it's a valuable strategy to streamline the sustainability of the HIV response, TB, and it's a key toward universal health coverage, but also HIV, TB, and NCD integration for the health system and patient may reduce duplication and fragmentation of services. Integrated services will increase coverage and reduce costs. You can see also some other additional systematic review. The first one showed that integrating TB and NCD service could enhance health service delivery across disease condition in low and middle income countries. And the second one emphasized the need for continued effort in incorporate NCD services in HIV care program and for better reporting in NCD related services. There are some challenges and risks in integrating TB and HIV and NCD services. The first challenge is related to the increase of workload for HIV and TB or NCD program staff, which particularly for HIV-TB care will require careful management. And there is also a possibility of hidden high out-of-pocket. And the other major issue is related to the supply chain in most of the developing countries. Availability of reagent and commodities would be something to consider over here. HIV, TB, NCD integration would, without appropriate resourcing, had risk of reducing the quality of current HIV and TB services without improving NCD care. And there is also the potential risk of impact reversal on the new infection. And I would like to outline here the domestic government funding, because most of the countries are relying on the external funding, and you know very well what's going on with the change of policy in the US. But, PEPFAR and other sources of funding have been experiencing some issues. Political and leadership commitment is also key, and that has been a challenge in most of the country. There is also a risk that stigma may influence the uptake of service for NCD care. WHO is provided a guidance on continuum of integration, and what is important is that we need to go from the prevention, diagnostic, treatment, rehabilitation, and also community care. And you can see, if we think of integration, this should follow this continuum of integration. Thinking while we talk of TB, HIV, and NCDs, the integration should be concerning all the level of the service, level of service, to make sure that that could be successful. So in terms of aim, I have already talked about of that. The aim of integration, we emphasize on sustainability of response, the increase efficiency and coverage, avoid duplication of effort, prevent and treat disease with shared risk factors, but also maximize synergy. The how is very important. The first thing is to identify the priorities, analyze characteristic of existing disease program, but also review global and local guidance, assess acceptability and resources and capacity, and then redefine and ensure compatibility and integration could be implemented at the end of the process. The WHO also provided some example of the level of integration that need to be considered. I'm not going to focus on this slide, but there are different elements also that could be considered. The people at the community. We need to look at the policy and the leadership, financing, capacity and infrastructure, but also the fifth level would be related to a model of care for NCDs. So let me share with you one experience from the two countries, ECPAF countries. So we did a cluster randomized trial, which is a model of service delivery integrating HIV testing, counseling into a community-based intervention for household TB contact management in Cameroon and Uganda. So the trained community health workers visited the household of index patients with TB diagnosis in 3 urban, semi-urban, and 6 rural districts. Voluntary HIV counseling and testing were offered to household contacts aged 5 years or older with unknown HIV status. 1,983 household contacts age 5 years or older were screened for TB. And of those, 83% did not know the HIV status, and 88% accepted the HIV testing, and 98% received the HIV testing. So HIV testing can be, okay. Oh, still acting up. Acting up. Okay, good. Thank you. So HIV testing can be integrated into community-based household. Community-based household TB contact screening and was well accepted in this study. So I'm having some issues. It's still okay. So I would just to say also another experience from Gabon, where the integrated screening for non-communicable disease and the risk factor during the TB assessment allowed early diagnosis, treatment initiation and chronic care management for NCDs, and that improved health outcome. And the recommendation was the integration should be implemented in all tuberculosis health facilities. So let me conclude with some critical consideration as we saw the recommendation from WHO on integration. So there are some specific important elements to consider. As I said, the first thing is the prevention, including primary prevention, behavioral intervention. So those, we need to think why we think of integration or TB, HIV, and NCDs. What are the activities at the prevention level should be considered, and how to articulate those activities to make sure that the health system program could be really efficient. So the integrated treatment model, what are the treatment models that are needed to be integrated, and making sure that they are really well articulated to be really, in terms of co-treatment protocols and supply chain. Supply chain is very, very, very key. Patient-central approaches, there are different approaches that can be considered, but how can we make sure that we articulate all those models to make sure that the integration will be successful. Service delivery, innovation, digital health solutions, task shifting models, and policy and funding models are also the key element to consider. We have also the cross-cutting element in terms of equity for health, research and data integration, resilience and pandemic preparedness are also some element to consider as a cross-cutting element. And here I would like to share with you some future research directions. And there are a lot of questions on the element that could be considered over here, but what model for care most effective integrated HIV, TB, and NCDs, cost effectiveness of research for integration model like PEN and PEN Plus that are proposed by WHO. How can we, so there we have a lot of elements that can be considered. Evaluation of differentiated services delivery models, economic evaluation and integration of versus vertical care models, sustainability financing model for integrated program, impact and integration or catastrophic health expenditure and financial protection for patients, and interoperability of data. Interoperability, acting up. Interoperability of data system for multi-disease management and longitudinal tracing. So I think let me stop there. So we have a lot of questions that could be really considered for integration of HIV, TB, and NCD. Thank you very much.